Buckles. I'm a neurosurgeon here at Orlando Health. So scoliosis is a condition where there's a curvature of the spine. Typically that'd be in adolescents or children, but not always. And the patients I typically treat are adults. So that's more adult degenerative scoliosis, whereas the spine ages, it curves, it deforms, it becomes very painful for folks. But majority of the people, when you think about scoliosis, it's adolescents. Some people are born that way, it's congenital. Sometimes it happens over time for reasons we don't understand. And then most people in between their 20s and 50s and 60s don't have as many problems with it, but as we age and the spine, like I said, degenerates, then it becomes more problematic. Scoliosis x-rays are a big one. And so for anyone who's seeing a provider for their scoliosis, you want to make sure you're getting scoliosis x-rays. You can see from the head all the way down to the pelvis, or even lower sometimes to the feet. If you're looking at just a window of the spine, it's really hard to get an assessment of what's going on there. So scoliosis x-rays, both front, back, and side, that's extremely important. So surgery is something we always talk about, but surgery for scoliosis is a big deal. You know, it's screws and rods and it's a fusion. It's a major undertaking. So it's not something we rush into. Probably only about 10% of the people we see with this problem end up having surgery. Really, I mean, treatment goals just get people feeling better where they're more functional. You know, we want their quality of life to be appropriate for them. We want them to be able to do the things they want to do. So most people can manage with therapy, body mechanics, and pain management, you know, kind of just different lifestyle modifications. We try and keep the patients who undergo surgery as prime patients for surgery. They meet all the criteria, they've kind of maxed out on conservative treatments, they're in quite a bit of pain, their quality of life is not where we want it to be. And for those folks, it's comparable to a total hip or total knee in terms of quality of life after surgery. You know, there's recovery involved, but once you get there, people are much, much happier. I love neurosurgery and working in spine specifically. You know, it's a lot of mechanics, it's body mechanics, it's tools, it's kind of reconstructing the spine. Scoliosis is a structural issue, but that structural issue can cause neurologic problems. When nerves get pinched, they can cause weakness, they can cause pain, you may not, your legs may not work as well. There are things that come along with it. We're a big team, Jewett Orthopedic Institute and us, we have a spine center, we're all very extremely collaborative, and it's all for the goals of improving patient care and having the best outcomes for patients. So we work with our orthopedic colleagues, a lot of folks with scoliosis, they have hips problems, knee problems, we collaborate there. We work with our pain doctors to make sure we're doing everything possible there. Another thing is, you know, bone health. When you're dealing with spine, we want to make sure we use our endocrinologists and all the team members on that side of the team as well. You know, spine in general, there's a lot of issues there, and we have an aging population becoming more and more problematic. So I think finding ways to minimize surgery, having smaller surgeries, having quicker recoveries is going to be important, and we do a lot of that here at Orlando Health with minimally invasive surgery, robotic surgery, endoscopic surgery. Those are all the goals of treating people with spine conditions. Finding ways to kind of improve overall health early on in life where you're maintaining core strength, you're good, your bone quality is appropriate, and try and prevent issues down the road will be important for scoliosis specifically. In terms of Orlando Health, you know, we've got a brand new neurosurgery institute here. We are a leader in the field of neurosurgery in Orlando. We've collaborated with the Jewett Orthopedic Institute, and we are working together on the field of spine surgery. So we've got a lot of resources under one roof, work very collaborative, it's all about patient care and finding the best possible outcomes for our patients. So very happy to be part of the team here.